This is Vegas Inc. with Dana Gentry and Jeff Gillen. We're minding your business.
And a Las Vegas doctor treats depression without drugs. We'll talk with him. Don't go away. A Vegas doctor is taking a new approach to treating a pervasive condition, the drug-free process, when we come back. A Las Vegas doctor is introducing a new treatment for depression, a debilitating condition that affects millions of Americans.
It is called transcranial magnetic stimulation therapy, and it involves small magnetic pulses delivered to certain areas of the brain that affect mood. Studies reveal repeated stimulation can improve depression in some patients. And joining us to talk about it right now, Dr. AURY Nagy. He is a Las Vegas neurosurgeon who uses this therapy in his practice. Welcome. Thanks for coming on our program. What's the track record of this thing?
It turns out it's more successful than any of the drugs that are being used to treat depression today. It's 30% effective in a cure rate, so patients after they go through 6 weeks of the treatment don't need to be treated any further after that.
I noticed on the website it says it's for somebody who has not had improvement from using a drug in the past. Any way you can just bypass the drugs and go directly to this? What's the purpose of that?
Those are the indications that were first set out for patients who were enrolled in the studies, and the studies were designed to treat patients who were most likely to benefit, who had already failed other therapies. They didn't want to introduce something to people that might not be safe, but it turns out it's as safe as getting an MRI, and it has a lower side effect profile than any of the drugs available today.
I imagine the drugs are not, I imagine the drugs are not that safe.
The drugs are fairly safe, but they can cause side effects for people in terms of sexual dysfunction, sleep disturbances, or weight gain.
Who's a good candidate for something like this?
Patients who have failed 2 different antidepressant medications fit within the protocol, but we're also starting to offer this to women who are thinking about pregnancy. Women who are going to be undergoing pregnancy, if they have to take antidepressant medications, they run the risk that those drugs can interfere with the development properly of the fetus. And so by getting off of those medications and undergoing transcranial magnetic stimulation, they can safely treat their depression and have a healthy pregnancy. And it works afterwards as well if they want to breastfeed.
I've been hearing a lot about depression and pregnancy recently, and it's something that you really never heard about before. Is there a hormonal reason? Are women who are pregnant more susceptible to depression?
There are a surprising number of women who, after their pregnancy, undergo a physiologic manifestation that is manifests as postpartum depression.
The baby blues. Everybody's heard of the baby blues.
Just so. And many of them go on to require treatment with antidepressant medications. This offers them a safe alternative while they're breastfeeding and while they are trying to care for their child.
What is the course of treatment using this method? I mean, is this a one-time thing? Is it a repeated thing? I mean, how do you treat somebody using this?
The patient will come to the office, and after they've been screened by a psychiatrist or a psychologist and have a documented depression, we will offer them this treatment. They will sit in a chair for about 35 minutes. During the first session, we'll identify the specific area of the brain that responds to this treatment, which is the dorsolateral prefrontal cortex on the left side. And once we've specifically identified that area, they'll undergo the treatment, which is about 35 minutes of stimulation every day, 5 days a week for 6 weeks.
Does it hurt?
In the first few sessions, it can cause some minor discomfort, and we do give the patients earplugs because the machine that performs the stimulation is rather loud.
How widespread is this being used? Are you the only person doing it here?
I'm the only person in the state of Nevada that's offering it to the general public.
All right. Well,
interesting. Very interesting
we really
stuff.
appreciate you sharing the information with us.
Thank you. Appreciate your time.
Thank you for having me.